there will be some presence Project Axshya, there will be some activity going on. Okay? Now, India, because it's such a huge country, Project Axshya has 9 partners and REACH is one of those 9 partners. So we work in Tamil Nadu. Similarly, CHAI, Catholic Health Association of India, works in some Maharashtra and some other states. VHAI works in West Bengal, in Bihar, in Jharkhand. So different partners work in different parts of the country. And what we will do is we will connect you with whoever the local partner is in your area. Because so we are sitting here in Chennai. Our role, after this process can be limited. You need to speak to people who are there locally. So we will make those connections for you. So what happens under Project Axshya is, as Dr. Nalini mentioned, it's very unique because for the first time, civil society, ye words we use a lot nowadays, this word civil society, is being involved in the TB control program. So by civil society, what do we mean? Local community organizations, NGOs, CBOs, panchayats. Idea is how can we involve every single person in the fight against TB, not just doctors, not just people, with clinical medical backgrounds, but everyone. But to work with the system, not start one tiny separate movement. There is no point in that. Is to work with the system. So, for instance, in 14 districts in Tamil Nadu, unfortunately, Mr. Kumar has left. But what we do, what REACH does, which all the other 8 partners do, is we've organized TB forums, for instance. We have what are called Gaon Kalyan Samiti meetings where we talk about TB. And these take place at multiple levels. So there's village level, there's district level, and finally there is at the state level. We train healthcare providers on soft skills. So because patient ka experience बहुत important है ना, when a patient goes to a center, you must feel like, okay, this person will help me out. So there are various aspects to Project Axshya. Community radio is one of those aspects because the union felt that as civil society, we should not forget community radios, one important major player in civil society. If there are 130 stations in the country today and Mrs. Sahu talks about wanting 1,000 stations, she wants 1,000 stations, think of what the potential is. So, the community radio project is implemented separately by REACH. The other 8 recipients partners do not implement this. This is only by REACH, which is why we work with people throughout the country. First year May, we worked only with 5 stations in Tamil Nadu. You will see there's a poster put up behind. Please take a look at it when you can, which talks about first year May, what was our process. This has been a learning curve for us also. So with every year we have made modifications. In the second year we worked with 10 stations across the country. And based on their feedback, we have changed the process for third year, 15 stations also from across the country. For instance, one example, second year May, each station was producing 16 episodes. As you all know, this year May, you will only be producing 12. Because the feedback we got is, some topics, 30 minutes was very, very difficult to produce. It was very stretched. There's not enough substance. So based on feedback like that, we have changed our own process also. So let me just tell you, to keep these in mind for the next 6 months, ये दोनों objective, please remember this. One very simple, very basic one, but also the most challenging, to improve awareness about TB among local communities. Please worry only about people in your area. What people somewhere else are thinking is not a problem at this moment. We want very focused activity, very focused. 5 kilometer radius, ठीक है, no problem. You don't need 25, 30, 40 kilometer radius. But 5 kilometer radius may, if there is only 80,000 population, no problem. But focus on that 80,000, on helping them understand this disease. The second point is, so we can all give awareness. Nariya awareness, we can tell them TB is, curable, this, that. But if they don't know where to go, what is the point of it? So, each program, each of your 12 programs, one very important thing is, you must connect them to local TB services. and not services 50 kilometers away, the closest possible service. And again this will change. Supposing ye diagnosis ka hai, the local service may be only 3 kilometers. Your nearest hospital may be diagnosis. But supposing it is a case of MDR TB, you may have to go little further away for treatment. So it is your responsibility, which is why we ask you to map aapka local health services also, to connect people to the easiest, most easily accessible service.
Topic is very clear. Topic is HIV testing. Any other plus points?
It's the size and the involvement. You can see the
Citizens can actually travel along with the one person.
Yeah.
Surya.
I'm listening, so I'm involved. I'm able to
It
listen to
sustains,
total.
it sustains your interest. Okay. Even though it's a scratch. Sustains interest in podava. So you can guess if it's in Tamil, it will be much more nice also. Rahul had something to say. Rahul, then Divyashree. Rahul, Divyashree, then James.
There's a voice behind, so we can get the. There's a voice behind, like English is there, even Tamil is there.
Yeah.
So we can get the feel also. We are able to feel it, whatever the doctor or whatever the patient is telling it out.
Anyone has done sound technician training here? Anyone works with cool editor, illana sound forge?
Sound forge.
New endo.
Okay.
Okay. This was done in 1 or 2 hours in a workshop, but you can do it even more beautifully.
Okay.
You can take it to the next level. But okay, so the feel, the mixing. Okay, I guess you feel okay.
Character we are using is Mommy, and she is HIV positive. When she is giving a best ending, positive ending, that's more important. The character itself. When she says that I got a counseling and I have got a new life. The patient itself is saying that I have got a new life, that is more positive.
So, true testimonials.
Yeah.
I'll make it here, I'll make it voice of the community. Voice of the community member. I remember when Reach did a training some 2 years ago, or when we did this HIV training in 2008, 2007, none, excepting for 2 community radio stations, none of the others had actually invited community members into the station and recorded their voices. Because they were all inside universities and it was just starting up. But now I think everybody has gotten community members into the station. Do you also take your recorder out into the villages and community and you record? Right? Anyone here who's not going out into the community? Or who's not yet started to do that? Everybody takes your recorder into the community? Perfect. Then,
This feature is like more virtual. I mean, the listeners could actually travel along with the person who is actually narrating it. So it's more virtual.
What she means is, it looks like you're there in the scene. You're there in the hospital or you're there with that patient. So I'm just going to puts you there. The feature puts you there at the scene of the action. It's not like listening to a news bulletin, but you feel you're there. मृत्युंजय
फीचर सुनने के बाद पेशेंट जो है उसके अंदर एक कॉन्फिडेंस आएगा कि वो किसी से बात कर सकता है, बात कर सकता है और ज़िंदगी खत्म नहीं हो गई, ज़िंदगी आगे है, उसके अंदर एक कॉन्फिडेंस आएगा. एंड सेकंड थिंग जो से हटके है मे बी हो सकता है रॉन्ग. डॉक्टर मार्जिनल वॉइस इज डॉक्टर आशीष.
Yes, that's Dr. Srinivasan. Okay, he says the community radio, it's because Bhavani is a HIV positive woman and she is speaking on radio, it gives her confidence also that she can come out and talk. And then
ஆக்சுவலாக கேட்கும்போது ஒரு விஷுவல் வந்து நீங்கள் அப்படியே ஆடியோவை கன்வெர்ட் பண்ண மாதிரி ஒரு ஃபீல் இருக்குது. ரேடியோக்கான ஃபார்மேட் இல்லை. ரேடியோ ஃபார்மேட்டில் பேசும்போது அந்த வாய்ஸ் டெக் பேசும்போது வளர்மதியோ அல்லது சம் எக்ஸ்ட்ரா டாக்டர் பேசும்போது அந்த வாய்ஸ் வந்து ஓவர்லாப் பண்ணுறது வந்து வீடியோவுக்கு கரெக்டாக இருக்கும். ரேடியோவில் இப்படி கொடுக்கக்கூடாது. அது ஒரு மைனஸ் தான்.
Okay. Minus is, he says it's not, this is more like done for a video. The way the fade under and everything has been done is more like, it sounds more like for a video soundtrack rather than
English
for
voice,
radio.
Tamil voice or some other language, you put another.
We can definitely improve that.
The Tamil is
to make it the classical radio format. the scratch from a workshop. It's just like 2-3 hours it was put together.
But how do you get that baby's voice? You know, in the beginning you went near her, or like it's natural sound?
Natural.
Some breaks if you want me. People automatically expecting some breaks.
This went very
So
fast.
continuously going on. That's all.
Because we said your news feature must not exceed 5 minutes.
More bit, little bit stage, some effects.
Definitely. This is only just a starting point. Just to illustrate for those who have not done news features, what is the standard format for a news feature. What are the minuses? We started hearing the minuses. Any other minuses of this?